Okay, hello everybody. Thank you for being here. We'll get into some numbers and then go through some different points and then take some questions. Uh, we currently have 322 cases, positive cases of COVID-19. That's up from 301 yesterday. That's 21 new cases since yesterday. Since last Friday, just 1 week ago, our cases have increased 162%. Adding to this, more of our residents are being hospitalized and more are succumbing to this terrible virus. Shortly after our briefing yesterday, we had our third death in the community. One of our neighbors, a male in his 80s, obviously we're thinking of him and we're thinking of his family right now. And our thoughts and prayers are with you. We have 26 individuals that are in the hospital. 15 of our neighbors are in critical condition. When we say critical condition, these are individuals who are in a fight and they are on ICU, ventilator type situations. One reminder about the hospitals in our daily reporting is I report data and statistics specific to Onondaga County. Throughout this process, we've talked about our region, how we are the medical hub, not just for Onondaga County, but for Central New York and Northern New York. Since this crisis has started, that footprint has even expanded during different days throughout this process when other parts of the state, whether it's the Capital District or downstate New York or Western New York, have run out of testing. These individuals have found their way to Onondaga County and we've never turned them away. They receive tests. But when you look at Central New York and Northern New York, where our hospitals meet the needs of individuals on a daily basis, when you're looking at elective surgeries, where do people from the North Country come for elective surgeries? Where do they come from the Canadian border to the Pennsylvania border? They come here to Syracuse, New York. And when we look at all of the positive cases in those counties that use our hospitals, it's not 322 cases. It's 800 positive cases from all the counties that service our medical infrastructure. We've been talking about this. We are on the front lines. We are the front lines for Central New York and Northern New York. And I think it's important that we continue to be recognized as the front line for a whole region of this state by the federal government and the state of New York. 6 people were released from the hospital since yesterday. Some good news. Today there are 87 people who have recovered and are released from mandatory isolation and quarantine. So a status check for today, our 2 curves that we're now following, 322 positive cases since this started, COVID-19, and we are presently monitoring 232 active cases. That number is up 8. Obviously, our goal is to be in a position as a community where each day we come here and there are less positives than recoveries. And that's when our curve not only flattens but goes the other way. That's the goal. That's why we're doing everything we're doing. So looking at this, 35 out of our 322 cases are household contacts of previously confirmed cases. We knew that this number would increase. Certainly, we ask people who are positive that get put into an isolation because you're positive. I know it's difficult within a house if you have children, and sometimes it's impossible to try to stay away from your loved ones in your house. But we really need you to do your best. When you're in a positive situation, you put yourself in an isolation where you're in one end of your house utilizing your own bathroom if at all possible, and try not to have contact with others in the house. But sometimes that's not possible. We understand that. When you look at the cases, some breakdown, 175 are female, 147 are male. 10 are under 19 years of age. 67 are in their 20s. 53 are in their 30s. 49 are in their 40s. 58 in their 50s. 47 in their 60s. 24 in their 70s. 12 in their 80s. And 2 in their 90s. 24% of our cases are under 30, 40% of our cases are under 40, 56% are under 50, 74% are under 60, and 26% of our cases are over 60. These percentages have remained consistent, somewhat surprising in the beginning of this process, but certainly they've remained consistent over the period of this process. Breakdown by municipality, 107 cases in the city of Syracuse, 34 cases in the town of Clay, 24 cases in the town of DeWitt, 23 cases in the town of Salina, 21 cases in the town of Camillus, 19 town of Cicero, 18 town of Manlius, 18 town of Onondaga, 13 town of Pompey, 11 town of Geddes, 9 town of Lysander, 8 town of Skinny Atlas, 4 town of Van Buren, 3 town of Lafayette, 3 town of Marcellus, 3 town of Atisco, 2 town of Tully, 1 Fabius, 1 town of Spafford. Geographically, the virus is everywhere. The virus does not care where you live, what you look like, who you are. It just cares to attack you. Looking at these numbers, there's no percentage breakout that's alarming, but there are towns that a week ago were further down on this list, and now they're higher up. It just shows you that we have community spread, and the safest thing to do is to stay home. Testing. So far, we've had 4,434 tests done in Onondaga County. We've had 322 positives. 4,112 negatives have been reported. We received 380 tests back since yesterday. There are 477 pending tests. Some of those pending tests are outside of Onondaga County. Again, hence this graph, that red graph you'll see, that all those communities are hubs. We are their medical hub. We are doing a lot of their testing. We are seeing their patients when they're sick. The number of hospitalizations I give you each day are for county residents. I don't have the answer how many other people are using our hospitals from other counties related to COVID-19, but I know how many positives they've had. Process after a positive test. Again, our health department is going to contact you and gather information about your direct contacts and the onset of your symptoms. This is how our health investigators will know who to quarantine through their investigation, and if there are gaps in their investigation, when to ask the public for help related to specific times and places. Anyone who has been tested must stay in a quarantine until you get your results. That was my executive order in the beginning of this process. That has helped tremendously stop the community spread and help our health department get in front of this. And thank you, everybody, for abiding by that. Because we have community spread, everybody should be self-monitoring our health on a daily basis. Look for these symptoms. We all know what the symptoms are. Sometimes these symptoms, you hear more and more about them. Strong headaches, aching, diarrhea symptoms, regular flu-like symptoms. If you have these, don't think this can't be COVID-19. We have to rule that out. So you need to contact your primary care provider. You need to stay home. Certainly, for those who are waiting to be released from isolation and quarantine, please be patient. Our health department is reviewing hundreds of cases each day. We are getting through releasing more individuals each day. Regardless, if you believe you should be released and you haven't heard from us yet, you are still under quarantine. You are not to leave that situation until we get to you. I know it's tough. I want to thank you for your cooperation with this. Certain tips, we do a thorough investigation on each positive case. Again, unless there's a gap in the investigation, we're not going to put out a release. When employers want to talk to their employees, really, by putting out a release or an email to the employees, we certainly work with the employers on language with them. But if you have a situation, I have emails every day. My husband works at this, or my spouse works at this, and we now know that there's been 2 positive cases. We're concerned. We haven't heard directly from somebody if we were potentially in contact. Our answer is if you have not heard from us, you were not in contact. And if we had questions about that, we would certainly put out a release and ask for information from the public. Okay, home isolation and positive cases. I'm going to go through this a little bit. As we have more cases in our county, we also have a need to release more people from isolation. That's obvious. As a reminder, those in mandatory isolation are those who have tested positive. In order to expedite the process, the health department now has an online password-protected application process where individuals who are recovering can input all of the required information regarding their health status. So we now have an online tool that you, if you are positive, can go to on our health department website to help us with their isolation release process. All of the data will be reviewed by our staff to ensure that we have completely accurate information. The end of the process hasn't changed. Anyone who is positive will be called by our staff, granting them their release. Reminder, even though people are released from isolation, this is not a free pass to get back. We have social distancing rules in the community right now, and the best way to make sure your neighbors don't go through what you just went through in that process is to, again, stay home. I want to ask all of our positive patients right now to consider registering for Upstates and the Red Cross's Plasma Donation Project, which was announced yesterday. I think we have our poster right over here, there. Please do that when you can. This is strongly encouraged for anyone who wants to participate in that research. Social distancing, thank you to everybody for taking this seriously. It's getting, we're weeks into this process now. Everybody's tired, everybody's a little frustrated. Sometimes people get cranky, myself included at times. But we need to stick with this. This is how we starve this virus. And at some point, we may ask the public for more related to this. And we may have to inconvenience you more to flatten this curve. So I just want to thank you all for everything you're doing and being good, really, community stewards. Certainly, our teams in the health department want us to talk about bad behavior when it happens, but we know that the community is, for the most part, abiding by the rules. They're leading in areas that they never thought they would have to lead, so thank you. I was asked a question yesterday about how many calls we've had in 911 regarding complaints relating to social distancing complaints. Since March 26th, the day after my 40th birthday, there have been 320 calls. So needless to say, people feel that others are still maybe not following the rules. Sometimes they're right, sometimes they're not right. Our positive numbers keep going up. This isn't going to get easier in the near term, so we really need people to buy into this and double down on this. Again, we may, based off of data, everything we've done off of data, ask for more sacrifice from the public if we think we can really help flatten our curve moving forward. As you may have seen earlier today, Central is now reducing some of their bus routes. This is, again, a social distancing technique. Obviously, these routes, once we get back to normal, will go back. But the more we can do to limit human-to-human contact right now, the better we will be. Assistance lines, our Upstate Triage Hotline, 315-464-3979. This is the line you go to if you don't have health insurance and you believe you have symptoms to get tested for COVID-19 at our testing triage site. This is also a line that you may get referred to for screening by a primary care provider if they are inundated. Certainly, this is not the line that you call if you're waiting on test results. You'll hear directly from the community center. I know I got a lot of emails from people saying, I missed the calls, who can I call back? Unfortunately, if you miss the calls, you probably got to wait for them to call you back. But when you email me, which many of you have been, I get those emails out to my team to follow up directly, so you'll hopefully get another call. And we try to respond to everything, every email we get as quickly as we can. Our seniors, our healthcare workers, an adult nutrition line, 315-218-1987. This was a line and a program that we started at the beginning of this process to make sure that our independent seniors and those who are now in a new class where we're asking you to stay home and not leave, you still need basic necessities. Through the work of volunteers and county employees, we've been helping these people get these necessities, and that's there if people need help. Nobody's getting left behind in this process. Childcare Solutions, again, a program we set up for daycare for our essential businesses. This even goes for the media, right? So remember that, you're essential. If you have daycare needs for a day or more because you have to go to work and your daycare falls through, 315-446-1220. Again, we've secured daycare slots for the month of April for all of our essential businesses, our emergency management workers, and our healthcare frontline professionals. Donations of PPE. Everybody, nobody probably knew what PPE was before this process. Everybody knows it well now. We're taking donations of PPE. Why are we taking donations of PPE? Because we don't have surplus supplies of PPE. Our phone number is 315-435-2525. Anyone who can help contribute to this. We don't get PPE and hoard it in a big room. We get it and we distribute it out to hospitals, nursing homes, other emergency management providers, your volunteer fire departments, your ambulance workers. This is not something where there's warehouses full of PPE in Onondaga County. Our veterans, please call 315-435-3219. We're here to serve your needs still. County government is still functioning. Please don't feel you're burdening us. If you have challenges, please call us. And again, mental health, we'll talk about it every day, and we do these briefings. We mix these briefings. I've had some people suggest our briefings have jumped the shark, as we say. The reality is we do these briefings because we do a FaceTime live briefing anyways to the public, because we have thousands of people that are waiting for these every day. And we'll continue to do these. We mix them together so that the media has an opportunity to ask questions. It's the most efficient way to do this. But we'll continue to talk about mental health and the fact that we are in unprecedented times, and this is tough. And so if you need to talk to a professional, contact 211, talk to mental health workers, and certainly get the help you need to keep yourself safe and keep your family safe. Saying that, we'll take questions.
Ryan, Governor Cuomo today made it pretty explicit that the state plans to take control of ventilators and other medical supplies throughout the state. Have you heard from the state about supplying them with ventilators from here? How much capacity we have to do that?
I knew this question was, one of you were going to ask this question, right? Yeah, but look at, I have not seen the executive order. I heard the governor. What I feel on a daily basis, I carry a large burden on a daily basis. The governor is carrying a very large burden, and there's our downstate neighbors in those communities, and I know many of these leaders personally, and they are going through hell. We have families in our community that are going through hell, and we've made decisions, and we had more time to plan and prepare. That does not mean we have put ourselves in a position where we are hoarding things that are unnecessary to our population. I have not heard from the governor's team that they need PPE or ventilators from Onondaga County. Why do I think I'm not going to hear from them? Is because they're giving me PPE when they have extra surpluses of PPE. They're helping provide some of that to us. So why would they give us PPE when we get it? It's not what we asked for, but our emergency management department works with theirs, and we put in a request for 3 days worth of PPE. We've gotten a couple, I think we've gotten a shipment last week, maybe one this week, where we got a day's worth, right? That's what they could give us. So if they needed our PPE, which we don't really have any, we're buying PPE because the state doesn't have enough for us. then why would they give us their own? So I don't think they're going to ask us for that. Related to ventilators, I don't know the context of what the governor's concern is. In our conversations with the state, we in Central New York very early came together with all of our hospitals, our emergency management team, and we figured out a plan for this community, knowing we would be where we are today, and we may be in a position where it's worse weeks from now. And we knew that, so we started to plan from that because of what we learned from other communities. So I don't know what the term surplus means and who they're talking to. I will review that. We will review it with our lawyers. Needless to say, ventilators are used not just for COVID-19 patients. They're used for many people who are sick, end of life, people who have cancer. We have hospitals. We have patients who are in hospitals with all those things. So we are also in a unique situation where part of why the state, you haven't heard me screaming at the top of my lungs for more PPE and everything from the state, is because we're kind of uniquely positioned with this medical infrastructure, and we have been going out, and when we can find a deal, we'll go buy it. Maybe other governments aren't doing that. But certainly if we didn't have any of that and we weren't doing all this, and I was in a situation where St. Joe's Hospital or Crouse Hospital or Upstate doesn't have PPE for their employees, I would be screaming to the heavens. And because we've done a decent job to stay afloat of that, doesn't mean we have surplus. So one of the things I think we've always said is that it makes sense if we can meet the needs of the 800 COVID-19 patients, not the 300, the 800, and which certainly would put us in the top 6 in the whole state, and certainly would put us in the, when you look at us from a region, would certainly put us in one of the larger numbers in the country. If we can meet those needs, then certainly if there needs to be a surge of patients from the city to the island to Westchester to Hudson Valley to the Capital District to Central to Western, that makes sense, and we're going to do our part. And if there's ways that the state thinks we can do our part, they just got to call us, let us know what they think.
Whether this helps Onondaga County's situation in the future or New York City's situation now, are there ventilators in places beyond hospitals? Are you aware of ventilators in any private practices in this county that, because they're not doing elective surgeries, might make those machines available if you need them?
I think we've heard from some smaller folks in the medical community that might have a ventilator or something that could be deemed as a ventilator. But I think it's important to reflect on where we are here, right? So I think over my time, I'm losing track of time on this because the days just bleed into each other. But I think 2 weeks ago or a week and a half ago in the same room, I wouldn't say I was getting beaten up with questions, but I was certainly being peppered with questions about what's your plan for a surge site and will you have the equipment you need for a surge site? So I said, I'm going to give you my plan, and I'm going to find a way to get the equipment because I'm in the front lines of all these communities. We can't let anybody down. So for us, if we are figuring out ways to try to implement that plan so that maybe our partners in the federal government or in the state can go continue to focus on other hot spots around the country and the state, if we do a good job, we're going to get penalized? I don't think so. I mean, so I think overall, we don't believe, I want to see the executive order. We don't believe we have surplus PPE. I know for a fact we don't. And when it comes to critical hospital infrastructure, we have done what is expected of the 470,000 people that elected me to prepare for the worst case scenario. We have now had to be the voice for many other communities in this process. And so we are in a spot where if we can meet those needs, which I think we're meeting and we're okay, if we need to be asked to do more, we would rather see people transition and move up to do more within our infrastructure, rather than disband infrastructure, and when our cases continue to increase, have to go chase down our own infrastructure in other parts of the world. That doesn't make a lot of sense.
In other words, it would make more sense to bring patients in if we have capacity than to send equipment out.
I think we're better equipped for that, and I think that puts our community at less risk than if we're being told that if there's a disagreement on surplus. It all depends on what the definition is here. And I'm not going to get in a point where people are trying to get me and the governor in a fight over this. The state is our partner. I support our governor in his efforts to help New Yorkers. I don't know what the definition is. If we have a disagreement over surplus, then we have to talk about that directly and what that means. And I haven't had that conversation. But I think what we've been saying the whole time is if we have the infrastructure in place and we can do more to help, we're going to do more to help. If the governor wants me to work out a deal to bring up people from the Capital District, or Danny McCoy down there, their county executive, or Steve Newhouse in Orange County, or any of my colleagues down in Long Island, or whatnot, we will do what we can do. But at the same time, there needs to be a recognition, which I believe there is. I'm not saying there's not, but that we're not, this isn't just Onondaga County we're talking about here. We are a much larger region when it comes to our healthcare system.
While we're on that subject, is there a round number of ventilators that we have in this region?
That's a number that I'm now very interested in understanding where it is and what models the hospitals have. I know we can just do some stats on our hospitalization rates, how they're increasing now, and how many of those, what percentage of our positive cases go on ICU beds, right? We have numbers with how many of those go. We got a little bit of time. I also have time where I can show you each week we're getting higher. Now we have recoveries too, but each week we're getting higher. And so we know there's increased demand for this infrastructure because of COVID-19. Elective surgeries have stopped. That's good. That helps with some of the demand. But we still have, nobody was using their ventilators for COVID-19 3 months ago. Now there is. Now they are. So the elective surgeries balanced off for all these new COVID-19 cases. So where's the surplus? So that's what we want to understand, what that definition means. I don't think the governor was talking to Onondaga County. And that's why I want to understand the context. And again, I'm not going to get in a food fight with the governor because I support what the governor's going through and what he's trying to do. We just need to figure out what our ability is to help. We think we're helping the state of New York by handling this, right? We think we're doing our part in a big way, and we're going to continue to do it. But if we can do more, we will. It just has to be in through a procedural process. And I know time's not on our side with some of this.
Are you getting enough data to be able to manage that big, it looks like 17 or 18 county region? Like you mentioned that you don't get numbers on whether people outside the county are in local hospitals.
Yeah. We're through our hospitals, Tim, we're getting updates related to their capacity and what constraints. Certainly there's COVID-19 is a bigger challenge for our hospitals this week than it was last week. And we have testing, right? A little bit of a model, huge testing demand. Next week, testing demand falls off. This week, testing demand's up here. Not where it was, but higher than it was last week. We know 7.4% of those tests are going to be positive. So out of 400 plus cases, we know we have at least another 30 positive cases there. We then got to go quarantine, contact, everything. So we know from that there's going to be more positive cases. So and we know the only way to get people out of recovered is through time, right? So the key is you need to slow down the positives and identify, quarantine, slow down. How you slow them down, you spread them out, you social distance. We look at policies that we have to put in place to do that, and we might be looking at more. And then eventually, you hope you get to the head of your curve. So they're saying in New York City, in Long Island, that might be coming, depends on each day. It's all fluid, what, 2 weeks? So if that curve's there, what's to say that we won't hit a curve in 3 weeks, or the peak? Maybe we cut it off before then. I think we've done a pretty good job to date, but we don't know. So instead of breaking down a system that's responded pretty well to this, let's bring in people into the system that's working well instead of disbanding the infrastructure.
How have and how would you like to see these neighboring county governments support Onondaga County's leadership, medically speaking?
I think after this, Andrew, we take the state's very smart when they do regional approaches to different things, economic development, other things. Certainly, I think regional approaches to healthcare and certainly in emergency situations, that's something that county leaders should talk about. Look, we're here. Everybody has, in many of these counties, they have some small hospitals, probably struggling right now financially. These hospitals make money off essential and elective surgeries. That's how they balance the public side of the healthcare system. They aren't doing that. Many of the northern New York hospitals, small, don't have a lot of PPE, scared to death right now. So we're there to take the overflow for all these communities. And it happens to be that many of the doctors that service these people work at our institutions, so that makes sense. And so we don't need any special recognition from any of our local partners. We're here to help each other whenever we can. We just need recognition from our federal and state partners when it comes to funding or reimbursements that we're not a community of 500,000. We're a much larger community when it comes to the healthcare system.
You mentioned in your opening remarks possibly asking the community to make more sacrifices. What might that look like?
I think the challenge in this HIPAA-dominated situation, I would love to be able to identify and study with our health department all of our cases and understand specifically what there's contacts, which you know you're going to have more, but there's affiliations between a lot of these cases. And my sense, and again, Dr. Gupta right now is only not here because she's busy working on all these investigations, trying to get me answers. But my sense is that recent cases, the affiliations, many of those have been preventable. That's my sense. So when that happens, what is it more that we have to do to further look at social distancing, and is there a policy role for that? And that's what we're looking at, and we're leaning on Dr. Gupta and the health department to help us with. We have to flatten this curve, and certainly if we can flatten this curve in Onondaga County, we can do more for the rest of New York State. But if we don't flatten this curve, being the metro area for central New York, we're going to be in a position where we're going to be struggling to handle our own region and not be able to help the other regions really. So I'm leaning on data, and I'm leaning on advice of our health professionals on what other things may happen. But certainly we may look at other executive orders related to social distancing.
You were very hopeful a week ago about the trend of the numbers. I sense a loss a little bit of that panning out, and it sounds like we're just simply not doing enough in Onondaga County.
Yeah, I think part of the challenge is I think it's taking different groups longer to buy into this, and I think overall we're doing well, but your margin of error is zero. And I think for a while we had other counties, the other thing too is look at, everybody's still, you got essential businesses that are essential, you got people who live in different communities commuting. There's a lot of contact. We're still very mobile with other communities. These are fake boundaries, that governmental subdivisions, right? There isn't walls up between counties and other parts of the state or the country. So you still have a level of travel going on. It complicates things. There's timing with testing. I'm still optimistic that if you look at our two curves, one's going up. I wish the testing demand was down this week like it was last week. Then I think we really would be optimistic. It's not where it was the first week, which is good. But I think our second curve, our active cases, it's not going like this. It's kind of picked up right here, and then it's kind of like that. So if that flattens out, that's positive, and that's the curve then you really watch. So I think we're doing enough to keep that curve almost kind of flat. But if we want to flatten it and drop it, we have to do more social distancing.
What groups aren't buying in?
Well, look at I mean at the beginning of this, I don't think anyone thought 40% of our cases would be under 40. That's been a consistent. I think the 50s have had a big jump. So I think you look at it. My understanding, just from body language and listening to Dr. Gupta, no specifics, is that a lot of these positives now are things that could have been prevented, and there's affiliations between them. And at some point, when they have more time to really do this, we'll know more about the affiliations. But that's something that I think there's no margin of error. It's zero with this virus if somebody is symptomatic and has it and they have contact with you. So we just got to do everything we can, and we got to stay home when we can. And one of the things I think parents should feel great about, I feel great about, is our number under 19 is fantastic. So parents have done a good job with their kids, not having some of these play dates with the young, especially the little ones. So there's good stuff in the data every day, Andrew, but there's enough that could, if you're a pessimist, you could be real pessimistic too.
Ryan, do you have an opinion on whether people should start wearing some sort of facial covering in public?
I don't think it can hurt, Tim. I don't think it can hurt whatsoever. I've gotten a lot of complaints about some of the retail stores that are still open the way people are. I went to Walmart the other day, not necessarily to buy something. I kind of walked around just to kind of look at things. I saw a report, I think, on Syracuse.com about Costco and some of the others starting to change their behavior, the way that they're letting customers in, and they're starting to consider looking at numbers. That would help with anxiety in the public a lot. I think a lot of this is anxiety. When I was in Walmart, there wasn't any, if I wanted to walk in a lane by myself, I could. But wearing masks, if you have them, it can't hurt, right? We don't, as the government, we don't have the ability to give them. The PPE that everybody's talking about, those masks, N95s. It used to be 70 cents. Now you got people price them at $7, right? If you wanted to buy one. If you go buy 500,000, you might get them down to a better price. So the government won't, your local government cannot supply you with them. Maybe at some point the supply chain opens up and the feds will send in hundreds of thousands of these and everybody can get one, but can't hurt.
I spoke to a COVID positive patient again for the second time. I'm doing a follow-up story with him tonight. He was tested again on the 14th day, which is different than the guidance Dr. Gupta's given about symptomatic-based discharge from quarantine.
Yep.
Is it because he's still symptomatic, which he's told me? I know you can't speak to specific cases of the government. This person has told me he still has symptoms. So is that when they'd probably retest you again?
Yeah, I think everything's evolving and the guidance is evolving, and the guidance might even change again with looking at investigations as they learn more about it. But my guess would be, and this is a guess, I have not been giving my medical degree. At some point, maybe somebody would give me an honorary one after this is all said and done. We'll see. But my guess is if that individual is symptomatic still and you're at 14 days, that does not meet the guidance that Dr. Gupta has given to leave isolation. So maybe a second test was given to see what that's like and maybe learn from that case as well. Questions?
There've been a couple of media reports looking at the effect on African Americans of COVID, which seems to be a little harder on that community than, do you have any kind of data that would speak to that?
I haven't seen the reports. One of the things that we were very cognizant about, Tim, when we started and looked at testing facilities for our triage testing site, was making sure that there would be a site that had access to underserved populations. That helped. That's one of the factors that went into going to the Syracuse Community Health Center, where it is within walking distance of our predominant African American and Latino communities, so that those folks could have opportunity instead of having it out somewhere in the suburbs. So I haven't seen the reports. I don't have demographic data on 300 out of our 301, how many are Caucasian or how many are minority or whatnot. So that's something that I will bring up to Dr. Gupta and ask her, though.
Also, to the extent you had time to look at the state budget and all of this, how is that going to impact Onondaga County so far?
Yeah, I think look at there's overall the state is facing their timing of their budget. Makes this really hard, right? Because they're doing a budget in the midst when everything's shut down. We did our budget at the end of last year, from January to January. We had 3 months of revenue flowing in pretty much unhindered. And so we're at mid-year, which is a challenge because we don't get to decide on revenue. We have to work within our budget. But I think looking at what the state was going through, if you got what you got last year, you did good. So I think overall, now what's the challenge here is they have a pay-as-you-go type system. So if you're a local government and the state's revenue doesn't happen, I think the governor has the ability to not pay you what you thought you may have gotten, which may force you to make mid-year adjustments. But to the governor's point, if there's no money, there's no money. That's the reality. So I think overall, Onondaga County, we're still assessing it. A couple things we liked. We certainly liked the cap on Medicaid. To remove that cap in this process would have been a game changer in a very bad way. And we would have, the draconian options we have to meet a mid-year deficit would be beyond draconian. I don't even know what we would call it. So that was helpful. They had a proposal, a 2-year proposal, which will cost us $2.2 million related to a fund for hospitals. That is certainly something that isn't necessarily helpful. That's $2.2 million that we have to come up with when we don't really have that money. But that's better than what the Medicaid proposal was. So if those two are connected, which I think they kind of were, that's better than that one. There's other things in there that are good for local governments. There's still CHIPS funding for roads, and they held the school districts essentially harmless from last year's. That's good. They could have, and then there's more specifics that we'll look through and we'll be like, okay, that's pretty good for us. But overall, for a situation where the state had the deficit they had, there wasn't going to be many winners in this situation. It's just how bad are the cuts?
Mayor Walsh isn't here, but the county's been a partner in the STEAM school.
Yeah.
What was the ultimate ruling on the STEAM school? I know it was mentioned and was given some love in the budget.
Yeah, the governor and the legislature got that through, which is very good. It's a signature project. One of the nice things we'll be able to do is we'll be able to look at now trying to move forward with that. The county's playing a very large role in that. It's a countywide school, first in the state. The county will essentially finance it, get paid back via the state, and use our line of credit, essentially our credit rating. So we're very happy. This was a demand from our businesses, really a workforce development, direct pipeline focused in on the STEM curriculum and the arts, which if you know young tech companies, the arts are important to them, and the way that folks who are very good at the arts. Their brains work very well with tech. So this was besides being a great opportunity for our young people, it was about workforce and about the demands of our employers that are growing fast. So this will be a shot in the arm for that, and really a key strategic project for the region.
Could construction begin in this coronavirus era? Would that be essential, or is that being pushed back now?
I think we're going to look now that, again, I've learned over the, I don't know how many years I've been doing this, 13 years, that you don't ever really start something until you get all your approvals. Now we got the approvals there. We'll start talking to the city about timeline and if the September 2021 opening is still realistic or not. That was always the goal. Could we get it done then? It would be very aggressive to get it done in that pre-COVID-19. It may be impossible post-COVID-19. Any other questions? No? No questions?
I have a prop for you
Okay.
to end the week.
Oh my goodness,
These
what
are
is this?
freshly disinfected hands passing these off. I just
Okay.
wanna let
Oh,
you
look
know.
at this.
But why don't
What
you
is-
look, open it up.
All right, folks. This is interesting. You got to be kidding me. All right. So I don't know how you got these, Andrew, but these are the McMahon glazed and confused donuts. Everybody. These are supposed to be out on Tuesday.
Take one out so we can see it.
All right. Let's do this. These are going to be hot commodities. Obviously, they picked out a decent picture of me. There was a lot of bad ones out there, so I'm happy they picked out a good one. Knaus takes bad ones of me all the time. I don't know. He's very good at it. But these sales go to our healthcare workers. So support Glazed and Confused. Buy some donuts. They're very good. And all the proceeds go to help our healthcare and frontline heroes in this process. And Andrew, there still is good news. I want to thank first all of our various volunteers, but also Recess Coffee, Howlett Hill Fire Department, Wegmans, and Tops for continuing to give us food, volunteers, and coffee. But in addition to that, since yesterday you asked us the question about the partnership with Upstate for the research project, we talked about it. We're highlighting it. We've had over 100 COVID-19 patients reach out about participating. So the good news is literally this community, whether we're sick or not, is all in this together. Thank you.